1 in 5 people on this planet will hear those 3 words at some point in their life. You have cancer. But what actually is it? Today we're breaking down cancer from the ground up, because before we can talk about specific types, you need to understand what's really happening inside the body. Welcome back to MedFacts, the channel where we break down diseases and health conditions in a way that's actually easy to understand. No scary textbook talk, just facts, with a little humor along the way. If you're new here, this is actually the start of a full series, so make sure you subscribe and follow along, because every video after this one is going to build on what we cover today. So, what is cancer? At its core, cancer isn't really one disease. It's a term for hundreds of related diseases that all share one thing in common: cells in your body growing out of control. Your body is made up of trillions of cells, and normally, they follow a very organized life cycle. They grow, divide when needed, and die off when they're damaged or old, making room for new, healthy cells. Cancer happens when that process breaks down. Certain cells develop mutations in their DNA that cause them to ignore the body's normal signals to stop growing or to self-destruct when damaged. Instead, they just keep multiplying, forming a mass of abnormal cells called a tumor. Now, not all tumors are cancerous. Benign tumors can grow, but they don't spread to other parts of the body and usually aren't life-threatening. Malignant tumors, on the other hand, are the dangerous kind. These are the ones that can invade nearby tissue and spread to other parts of the body through the bloodstream or lymphatic system, in a process called metastasis. This is honestly the scariest part of cancer, because once it spreads beyond its original site, it becomes significantly harder to treat. Cancer has actually been documented for thousands of years. Ancient Egyptian papyri from around 1600 BC described cases of breast tumors, and it was the ancient Greek physician Hippocrates who coined the term, using the Greek word karkinos, meaning crab, because he thought the swollen blood vessels around a tumor resembled a crab's legs. Honestly, that's one of the more oddly specific medical observations in history, but it stuck, and the term evolved into what we call cancer today. Let's talk numbers, because the scale of this disease is honestly hard to wrap your head around. In 2024, there were approximately 21 million new cancer cases diagnosed worldwide, and nearly 10 million people died from the disease globally. That's roughly 1 in 5 people who will develop cancer in their lifetime. Lung cancer currently leads globally in both new cases and deaths, followed closely by breast cancer and colorectal cancer. And unfortunately, experts project global cancer cases could rise to 34 million annually by 2050, largely due to population growth and aging. It's a sobering number, but it's exactly why understanding this disease matters so much, and it's exactly why we're doing this series. So what causes cancer in the first place? This is actually where a lot of misconceptions come from. Cancer isn't caused by one single thing. It's usually a combination of factors. Genetic mutations can be inherited from your parents, but most cancer-causing mutations actually happen over a person's lifetime due to external factors. These include things like tobacco use, which remains one of the single biggest risk factors globally, excessive alcohol consumption, prolonged sun exposure without protection, certain viral infections, exposure to harmful chemicals, obesity, and in some cases just plain bad luck through random cellular errors during cell division. Yes, sometimes your cells just mess up on their own, which honestly isn't the most comforting fact, but it's the truth. Now let's talk symptoms, though this is tricky because cancer symptoms vary enormously depending on the type and location. That said, there are some general warning signs worth knowing across the board. Unexplained weight loss, persistent fatigue that doesn't improve with rest, unusual lumps or swelling, changes in skin such as new moles or sores that won't heal, persistent cough or hoarseness, changes in bowel or bladder habits, and unexplained pain that doesn't go away. None of these automatically mean cancer. They're often caused by far less serious conditions, but they're worth getting checked out rather than ignored, because early detection dramatically improves outcomes across almost every cancer type. Now here's where we get to the hopeful part, because cancer treatment today looks nothing like it did even a couple decades ago. There's no single universal cure, since cancer isn't a single disease, but treatment options have expanded massively. Surgery remains one of the primary treatments for removing tumors when possible. Chemotherapy uses drugs to kill rapidly dividing cancer cells throughout the body. Radiation therapy uses targeted radiation to destroy cancer cells in a specific area. And in more recent years, we've seen incredible advances in immunotherapy, which essentially trains your own immune system to recognize and attack cancer cells, and targeted therapy, which attacks specific genetic mutations within cancer cells rather than just any fast-dividing cell. Survival rates for many cancers have improved dramatically over the past 30 years thanks to these advancements, along with earlier detection through improved screening methods. Now let's talk prevention, because while not all cancer is preventable, a significant portion actually is. Avoiding tobacco use alone could prevent a massive percentage of cancer cases and deaths worldwide. Maintaining a healthy weight, limiting alcohol consumption, protecting your skin from excessive sun exposure, eating a balanced diet rich in fruits and vegetables, staying physically active, and getting recommended screenings like mammograms, colonoscopies, and pap smears can all significantly reduce your risk or catch cancer at its earliest, most treatable stage. Vaccines also play a role here too. The HPV vaccine, for example, can prevent cervical cancer and several other cancer types linked to that virus. This has been our foundation episode, the What is Cancer Deep Dive. Going forward in this series, we're going to take everything we covered today and apply it to specific cancer types, one at a time, so you'll start recognizing patterns and understanding why certain cancers behave so differently from others. Look, I'll be honest with you. Putting these videos together takes a lot out of me. The research, making sure every fact is accurate, writing it in a way that doesn't feel like a boring biology class, editing it all together. It's a lot of work behind the scenes. But I do it because I genuinely believe health knowledge matters. And honestly, I do it for you. If this video taught you something today, do me a favor and hit that subscribe button. It might seem small to you, but it means everything to me. And it's the exact reason I keep showing up to make these videos. Drop a comment too. Tell me which type of cancer you want me to cover first in this series. And as always, if symptoms persist after 3 days, please consult your doctor.